It's a huge question to ask about Dr. Frank's contributions because they've been many, they've been varied.
Dr. Frank was very integral in orthopedics in Canada and medicine in general.
His innovation in trying to develop new ways to deliver care was of such a great impact on both Alberta orthopedics and Alberta medicine.
Well, I first met Cy in an interview process for the 13 inaugural scientific directors of the Canadian Institutes of Health Research. Everyone assured me that he was a great leader, a great individual, and a great scientist. Cy and I worked closely together for the next 7 years, me as president of CIHR and him as one of the 13 scientific directors.
I worked for Cy at Alberta Innovates Health Solutions when he joined 2.5 years ago as the CEO.
One of the lasting legacies for Cy, I think, has been the establishment of this Center for Mobility and Joint Health. The McCaig Institute is a big part of that. And what Cy always believed was the power of putting an engineer together with a clinician to have that collaborative environment.
As a researcher, he had the respect of the entire orthopedic research community throughout the world.
One of the great attributes that Cy had was his ability to put it all together, to form a plan, to get people behind that plan, but then to be able to implement the plan. And that is very, very hard.
Engineering, kinesiology, nursing, rehab medicine, the hard sciences, rheumatology, orthopedic surgery. That was all his vision, and he wanted us all mixed up. He was adamant that we had to be all rubbing shoulders day to day in this multidisciplinary group.
Cy really believed that research could inform better clinical care, but he worked in the real world, and he understood how he had to make changes locally, how he had to make changes provincially, how he had to affect change nationally. And that really earned him a reputation in Canada and beyond as somebody who passionately believed in better clinical care for people.
He had a really strong vision around the value of sharing health information and what that could mean for the improvement of providing services to the patient.
He struggled with some of the injury-related things that many of his patients did, and that helped him, I think, identify with patients.
I think that's what really made him who he was and why he has garnered so much respect, is because of that ability to relate to people, no matter their background, no matter where they come from, and be able to bring people together to share ideas. People felt like he was genuinely interested in what they had to say because he was.
The lectureship is intended to promote and to make sure that those enduring qualities that Cy represented are continued even now that he isn't with us.
I think he'd say keep going. You know, he leaves behind a real huge number of champions that are trying to make the world a better place, that are trying to make it better for patients and it better for clinicians.